My name is Maija Lipponen, and I work as researcher in Natural Resources Institute Finland. We call it LUKE. And I'm also a PhD candidate at the University of Eastern Finland. And at my work and my studies, the themes are the human health and nature, and how they are linked and connected. What are the health benefits of nature to humans, and what is the impact of human on the natural environments? We speak about planetary health and well-being nowadays. My background is in chemistry and environmental sciences, and now I study social and health sciences, and I like the way I can connect these sciences together. What is a health forest? Health forests have been established in different parts of the world, especially in Asia, where they are used and studied a lot. Their doctors prescribe people to go to the forest to lower stress and burnout, for example. In Finland, there are special health forests which have been established recently, last years, near hospitals like in Kajaani and Lahti cities. And the idea is that the well-being benefits come from the nature, but also from meaningful activities and social interaction between people. And this is the idea how to use nature to support the well-being of people. The selection of these health forest areas, locations, and the visits to these forests are based on the research data about the health promoting elements of forests we know from the literature, and also the well-being mechanisms of nature we know through the study. And I present you an example from Kajaani Health Forest. We planned this health forest in a project that ended last year. The project was called Health Forest in Promoting Work and Functional Abilities, and it was European Social Fund project by LUKE and Kajaani University of Applied Sciences. And the health forest was planned in collaboration of Municipality of Kajaani and the Wellbeing Services County of Kainuu. We have several well-being services counties in Finland offering social and healthcare services. And this area where the health forest was established is a recreation area of Kajaani municipality, and it's partly area of Kajaani Hospital owned by the Wellbeing Service County. So this was a collaboration and by many organizations together. And in this picture on the left, you can hardly see the hospital on the background of the forest. So it's a very short way to come to this forest. And there is a shorter accessible route where nature is included in the route, as you can see. And then there is a longer nature trail in this forest. And this accessible route from hospital leads to forest, and there is an information board about the health benefits of nature in the beginning of the route, and all the texts and the map is also sensible, not only visual. There are handrails, seats, and resting spots, and seats are on different levels for different size of users. And all information boards are also sensible, and there are some exercises on them where you can stop and make some small exercises in the nature. And that helps you to stay in the nature for a while and also use all your senses in the nature. And that allows you to get these health benefits from the forest. This accessible route is suitable for moving with wheelchair as well. Also suitable for groups and individuals. And this longer 1 kilometer route is non-accessible. It's suitable for leisure time activities for citizens, for example, but also it can be used in physical therapy or occupational therapy from the hospital. There are many different users of health forest. Healthcare practitioners at the hospital can use the forest in patient work, in therapies, rehabilitation, mental health services, and they can also use it at the well-being at work and their own meetings and discussions. The patients of the hospital can use the forest by themselves and with the relatives. The forest is open for everyone, so the citizens of Kajaani can use the forest in recreation. The near kindergartens, schools, and the Kajaani University of Applied Sciences can use the forest for recreation and learning environments. Different associations, patient organizations, and travelers are also the users. And one good feedback I got is that on the right, that now we have a permission to be outside in nature with patients to support their well-being when we use this health forest. This forest has always been there next to the hospital, but it hasn't been used in patient work before. But now when it has the name health forest, and also we have done some training to professionals and some marketing of these health benefits to professionals. Now they know them and they know how to use this forest in goal-oriented way at their work. So I think this is good feedback. What else and what next? We have also mapped other suitable health forest areas in Kainuu. On a map, there is a link to this, and we have published a guidebook about health forest activities and also the research in the background. And this publication is in English. There is a video about Kajaani Health Forest Route. You can watch it later. There are subtitles in English. And on the project page, you can find more materials. And now at the moment, we have a survey going on for the employees at the Wellbeing Service counties in Finland. And the aim is to find out what is the usage of these health forests at the public health and social services. And we have started our next project, which is called Nature Prescription. And this aims to develop and study a nature prescription protocol in the promotion of health and well-being of citizens in Kajaani and Lahti. So we make a protocol how to guide people to the nature contact, and then we study the well-being effects. And this will be ready in a couple of years. Thank you, and I wait for your questions.